Good afternoon, students. We will wait for a few minutes for the others to join.
Mm.
Okay, so I think we can start. Only two, three are left. No problem. We will start the class. Have you got your LMS?
Yes, miss, but no slides inside there.
No, have you got it? Because I didn't get any information.
Yeah, we got it.
You got it. Okay, I will check because I didn't get any link. Maybe I'll check with your batch coordinator and I'll upload by today then. So last class we saw about coordination. So coordination means it is a timingly movement or movement that is taking place in a smooth and proper timing manner. So when this coordination needs to be controlled by muscular pathway as well as neural pathway. If any of this is affected, then the person will be having incoordination. So in case of muscle, whenever the muscle is weak, whenever the muscle is flaccid, or whenever the muscle is spastic, then it will be affecting the coordination. Same way, same wise, if the cortex or cerebrum is not getting proper information from the muscles, that is your afferents, or if the cerebellum is not getting proper information from the proprioception and the kinesthetic sensation, then again it will be affecting the coordination. So whenever this coordination is affected, most of the time it will be going with along with balance, because balance and coordination are two twin things. So most of the time when coordination is affected, balance also will be affected. Is that clear? So you need to do test. You will be doing test in two ways. That is non-equilibrium test to check your coordination, and equilibrium test for checking your balance. So balance we will learn next week. Like next chapter is balance. So you will have more understanding between coordination and balance. Okay. So we saw these are the factors that will be affecting coordination. And when you feel the particular person has some problem, then you will be doing certain tests for the upper limb as well as for the lower limb, and you will find out whether the problem is affecting the whole limb or only one side or both the upper limb or both the lower limb, like that. So we have seen many tests. So after doing the test, so it is not mandatory that you have to do all the tests. So you can, it is enough if you do any two tests of upper limb and any two tests of lower limb in case if both are affected. Okay, then you will be documenting. So after documenting, what we will be doing? So that is our treatment part. So here treatment is re-educating particular movement. Okay, so the complete movement we need to re-educate. So that is our treatment to improve the coordination. So here what like re-education means, we will be using the like available pathway, and whatever the pathway is there, that pathway we will be using, and that pathway we will be stimulating, and slowly we will be progressing. So for example, we know that the information has to be got from the muscles, that will be taken to the cerebrum. Then the cerebrum will be deciding about the sequence of the movement. It will be sending this order to cerebellum. So cerebellum will be receiving the information from the proprioception, that is the joint, and the kinesthetic sensation. And the cerebellum will be utilizing the previous memories, and it will fine tune the movement. Then it will be giving back the efferent. So this is the continuous circle. So in case if any one is affected, then we need to try to use the alternative pathway. So directly without the cerebellum also sometimes we will be able to do the movement. So we have to just see whether we will be able to correct it or use the alternative. So in case if the muscles are affected, then we will be able to correct the things, and we will be able to improve the coordination. If something is wrong in the nervous system, sometimes when it is central nervous system, we will not be able to regenerate or re-educate. So in that manner, we will be using the alternative, whichever is available, the alternative, then slowly we will be progressing. So this is called re-education. Okay, so whenever the muscle is affected, then we have to correct it. Whenever the nervous system or nervous factors are affected, then we will try to use the alternative. Okay, so what are the problem that will be having in a muscle? So the muscle can be weak, the muscle can be spastic. So when a muscle is weak, then we can strengthen the muscle. When the muscle is spastic, then you can do the stretching. Is that clear? Okay, so this is called as re-education. That is, coordination is affected, so we are re-educating the coordination, and we are going to improve the movement. Okay, so that is called that is the treatment for in coordination. So what are the principles of this re-education? So how do we, or what is the basis of this re-education means? We have four bases. First one is when the muscle is weak or when the muscle is flaccid. Okay, so whenever the muscle is weak or whenever the muscle is flaccid. Flaccid means it denotes the tone. Okay, so flaccidity is reduced tone or no tone. That is called as flaccidity. Okay, whenever a muscle is having weakness or flaccidity, then we can then this will lead to incoordination by using lot of trick movements. So as a treatment, first we need to improve the muscle power. So to improve the muscle power, we have several techniques like strengthening technique, so or ROM exercises. So depending on the muscle power, you need to select which particular technique you want to use to improve the muscle power. Apart from that, we have some other techniques called hydrotherapy. We have some other techniques called PNF and all those things. Okay, so by the end of this semester, you will have still a lot of techniques to strengthen the particular muscle. So to strengthen the particular muscle, you need to do strengthening and other techniques which will help you to improve the muscle power. Okay, so whenever the problem is in the tone, that is either reduced tone, that is called as flaccidity, then you can use some techniques to improve the tone or to induce the tone. So that is called as facilitating technique. So that also we will be learning after we will be learning after 2-3 weeks. So we can do some facilitating techniques, and this facilitating techniques will help you to improve the flaccidity. Is that clear? So in re-education is based on 4 principles. The first principle is whenever the muscle is weak or whenever the muscle is flaccid. So whenever the muscle is weak, you need to use the strengthening technique, strengthening exercises. You need to do MMT based on the muscle power. You will decide what technique you want to use. Then, when a muscle is flaccid, flaccid means reduced tone. When a muscle is having reduced tone, then you have to induce the tone or improve the tone. So, to induce or improve the tone, that is called as facilitating technique. So, we will be learning the facilitating technique later. Okay, so this is the first. Second is, in case the muscle can be spastic. Spastic means increase in the muscle tone. Okay, so in the muscle, either you will be having weakness, flaccidity, or spasticity. So in case if the muscle is spastic, then you will be doing stretching and relaxation technique to reduce the tone. Okay, so when a muscle is spastic, that is called as increased in the tone, then you need to use techniques like stretching or relaxation technique. So this will help you to reduce the spasticity or reduce the tone. Third is, third problem will be maybe if there is any problem in the cerebellar region. So here the cerebellum will be receiving the information from the muscle, then it will be deciding the action. That action will be sent to the cerebellum. In cerebellum, it will be receiving some more information from the proprioception and the kinesthetic. Then the action will be fine-tuned. Then it will be sent back to the muscle. So here we have 4 things. One is muscle, cerebellum, cerebrum, cerebellum. Okay, so these 3 things will be coordinating the, these 3 things are essential for the coordination. So the muscles will have 3 problems like weakness, flaccidity and spasticity. Okay, so you will be doing some techniques to improve this. Then if the muscles are normal, then it will be receiving, it will be sending a proper information to the brain, that is cerebellum, cerebrum. Then the cerebrum will decide the action. Is that clear? The next problem is your cerebellum. So the cerebellum has to receive the information like proprioceptic and the kinesthetic sensation. Then it will be fine tuning. In case if the cerebellum is not receiving the information properly, then also the coordination will be affected. So not receiving the information means any lack of sensory pathway. So sensory pathway is your nervous pathway that is bringing the information about the sensation. So sensation are your proprioception is one type of sensation. Okay, so we have deep sensation, superficial sensation, in deep sensation, we have this proprioception and kinesthetic sensation. So whenever this pathway is affected, then the cerebellum will not be able to function normally. So we need to go for an alternative pathway. So we need to find out alternative pathway. So that means if proprioception is not informed properly, proprioception means position sense. So for example, the brain has to know whether the knee is in flexion or in extension. Okay, so if it is not getting the information, that is your proprioception, then the alternative pathway is you can see visually whether the knee is inflexed or extended, isn't it? So this is called visual pathway. So when the sensory pathway is affected, then you can use the visual pathway, that is your alternative pathway, and to then you can do the movements and improve the coordination. Okay, so that means the cerebellum needs to have two sensation. One is proprioception, another one is kinesthetic sensation. Whenever proprioception is affected, or whenever the proprioception is whenever the joints are not informing the brain properly about its position, then you can use the alternative pathway. Here the alternative pathway is visual pathway. Okay, then another alternative pathway will be auditory pathway. Auditory pathway means like you can orally tell the patient that the hand is in flexed position, the hand is in extended position, like that. So the brain will know whether it is in extended or flexed. Then by using the alternative pathway, slowly it will be improving, and it will be the movement will get normalized. Is that clear? So this is the third principle. The fourth one is when the kinesthetic sensation is affected. So similarly, like your proprioception, the kinesthetic sensation also, for kinesthetic sensation also, you can use the alternative pathway. So using this alternative pathway, you will be able to improve the cerebellar function. Is that clear? Okay. So when coordination is affected, broadly we can divide into two. One is the problem in the muscle, the other one is the problem in the nervous system. So when the problem is in the muscle, then you can do strengthening, you can do stretching, you can do relaxation, and you can reduce the tone and other things. When the nervous system is affected, then it will not give the proper information to the cerebellum. So the cerebellum will not be able to work properly. So in that way, we have to use the alternative pathway to improve the nervous system, or to improve the movement. Okay, so here is the exercise that is called as Frankel's exercise. This was formulated to improve the kinesthetic sensation and the proprioceptive sensation. That means whenever the patient has problem in the cerebellar region, then you can use this particular technique called Frankel's exercise. So this Frankel's exercise will help us to use the alternative pathway and improve the coordination. Okay, so I repeat again. So the coordination is affected by two ways. One is muscle, another one is nerve. When the muscle is affected, then you can either check the MMT, and according to the MMT, you will either improve the muscle power, reduce the muscle tone, or improve the muscle tone. Okay, when the nerve is affected, then only you will have problem in the cerebellum. So here the cerebellum will not receive the informations like proprioception and the kinesthetic sensation. So in this case, you have to use the alternative pathway. So how to use this alternative pathway is by using a technique called Frankel's exercise. Is that clear? So the Frankel's exercise is a technique that was developed by Dr. H.S. Frankel. So that's why by his name we call this technique as Frankel's exercise. So this technique will help you to induce the alternative pathway. So people who are having problem with the sensory pathway, you can use this technique to improve the alternative pathway. So what are the alternative pathway is? Visual pathway, the remaining the pathway that is present, that is your visual pathway. then auditory pathway, that is your sound and other thing, then by touching the patient. Is that clear? So these are the alternative pathway we will be using, and by using this we will be able to improve the alternative pathway and we will be able to improve the coordination. Is that clear? So here when we say the alternative pathway, see I am not going to touch the other part, that is your strengthening exercise, stretching, then facilitating technique we will be seeing it later. Relaxation we have already seen in the last semester. Okay, so for all these things we have already learned. So that's why I have just come to the second part of the training. Is that clear? So first part is you need to improve the muscle by strengthening exercise, stretching exercise, or by facilitating technique, or to reduce the tone. All these things you can do. That is your first part. So second part is you have to induce the alternative pathway. So how to induce this alternative pathway is using this Frankel's exercise. So here what you do is you compensate the affected pathway with whatever is available. So for example, without seeing my leg position, I can know that how is my leg, isn't it? So now when you're sitting in the chair, without seeing your knee, you can say that your knee is this much flexed or this much extended. So this is how it happens is because of the proprioception sensation that is sent to the brain. When this is affected, then you have to use the alternative pathway. Like what is the alternative pathway? Visual pathway, that is you can see your knee, how it is positioned, then you can know it. Okay, then you can touch your knee and see, okay, it is flexed to this much degree. You can touch and feel. Then other person can see and tell you your knee is this much flexed. So these are the alternative pathway we need to train the person, and we need to improve the coordination. So when you are doing this, you need three essential things in the Frankel's technique. Those are concentration, precision, and repetition. Concentration, because you are going to induce the alternative pathway. So you need to concentrate more compared to the normal. So the patient have to concentrate on the movement continuously so that he is able to achieve the technique. Okay, so he need to concentrate more and more. He has to observe it. He has to see it. So that is called as concentration. Okay, so the patient have to concentrate, or the patient has to give attention to the movement when he is performing. So this will help them to improve the coordination. Another one is precision. Precision means perfectness. So you need to treat the person, or you need to give the repetition so many times that precisely the person is able to do the movement. Okay, so precision is very, very important. Precision means perfectness. So if you say 35 degrees dot, the person have to do only 35 degrees. The person cannot go to 36 degrees or 30 degrees like that. So when he does that, then it will be overriding or underriding, then it is called as incoordination. Okay, so the precision is very, very important. The next is repetition. So the patient is supposed to repeat the movement so many times till he is achieving the precise movement. Is that clear? So the first thing is the patient need to concentrate more so that he is able to capture the movement accurately. Second is the patient have to repeat the movement until and unless he is achieving that precise uh, action or precise degree. Okay, so these are the three essentials that we have to keep in mind whenever we are giving the treatment. Then apart from that, we need to follow certain things so that the person is able to improve the coordination. So it is not like your resisted exercises, like you will be doing some 10 repetition, then you will give them rest, then again you will do some 10 repetition, again rest, then again 10 repetition. So one day you will be doing this 30 repetitions with 3 sets. Okay, so like this kind of things we cannot talk in in coordination, because in coordination exercise you need to do till they are achieving the precise movement. So you need to keep repeating maybe 100 times, 1000 times or 10,000 times till the person is achieving the perfect movement. Is that clear? So you don't have certain repetition or frequency in this particular technique. So there are certain things which we need to keep in mind so that we will be able to do this Frankel's exercise. The first thing is the patient has to be positioned in such a way that they are able to observe the movement properly. Okay, so they need to wear certain proper clothes so that they are able to do the movement freely. So the patient have to be suitably dressed and the patient have to be suitably positioned so that he can visually see the movement. So that is the alternative pathway. So visually the patient have to see the movement so that he is able to improve the alternative pathway, and that way it will indirectly improve the coordination. So that is the first guideline. Second is, so you need to explain and demonstrate very clearly, because here the patient problem is imperfection. So the patient is not able to do perfectly. So that is the patient's problem. So you need to explain them very concise or demonstrate very much clearly so that they are able to do the movement perfectly or achieve the movement perfectly. So make sure the patient is getting a clear picture in his mind. So that is very important. Then third is the patient have to give full attention to the movement. That means whenever the patient is doing the movement, he is supposed to keep seeing the movement or concentrating the movement, and he is supposed to uh, uh, see will have to give attention to the complete performance. Then only he will be able to get the smooth and accurate movement. So he should not be concentrating in some other thing. He should not be hearing the music and keep doing the movement. It is not like that. Like you can see many people who are going to gym will be like putting their earphone and they will be hearing music, and then they will be doing lot of movement. So here they don't concentrate on the movement at all. But in Frankel's exercise, the patient have to give their complete attention so that slowly they improve their coordination. Then next is the speed has to be dictated by the physiotherapist. So the speed and the rhythm have to be dictated by the physiotherapist. That means from outside we need to keep on telling them telling them so that the speed is either increased or decreased, or the rhythm is either increased or decreased. So that is dictated by the physiotherapist. Then the range of motion till which they are supposed to do the movement. So that is indicated by some color pens or some color object or some marking has to be given so that the patient is able to see the range of motion, required range of motion. The next is the exercise should be repeated until it is perfectly done, or until it is easily done. So until then you need to keep on doing the same exercises. So once he has achieved then you will be you will be taught the other one. So next one you're going to concentrate. Is that clear? So until and unless that particular moment you are able to achieve, till that you will not be progressed to the next. Then all these exercises are very tiring at the first. So initially it must be very tiring because you need to concentrate in many other things. That is, you need to precisely watch how they are doing. You need to precisely see whether they are able to precisely they are able to watch all those things. So all these things will be tiring. So they need to give more concentration. So that will be more tiring for the patient. But slowly, when you give rest time and when you repeat frequently, you will be able to achieve this thing. Is that clear? So these are the 7 points that you have to keep in mind, or in other words, you have to see these are the 7 guidelines you have to keep in mind when you are doing this particular. Okay, then how to progress the exercises? So the exercises can be progressed by increasing or decreasing the speed, increasing or decreasing the range, or increasing or decreasing the complexity of the exercises. So the progression can be in three ways, either the speed, range and the complexity. So all these things will help you to go for the progression. Okay. So these are the exercises. I will show you the video to explain how to do the exercise first. Okay, one. You can use the, actually you can also use the testing methods to do the Frankel's exercise. Okay, so you can use the same finger to nose, or you can use the same finger to finger exercises to improve the coordination. Is that clear? Okay, 1 minute. Rather than this, I'll show you one more. Okay, this is a very big video which is showing your testing as well as exercise. Okay, so I will just show you the exercise alone now, because every whole video it takes around 30 minutes. Or you want to see the complete video, it's nothing wrong, you can see it. So the only the language will be little difficult, but this is a video of a complete class. So he will teach you clearly how to do the testing as well as how to do the exercise.
And having some direction, timing, speed, everything is very important in doing a coordinated activity. Okay? And two important motor activity, gross motor activity. Okay, you understood? Now I am standing, whether I need balance or not. Or you are doing in standing, in a standing upright position, in a standing position. This we call it as equilibrium coordination exercise. So non-equilibrium coordination exercises, you will do it in lying or in sitting with support, fully support. And equilibrium coordination exercise, you will do it in standing. Okay. Now first we will see non-equilibrium coordination exercise. I will show you how to do that. Very simple. First one, finger to nose. Finger to nose. Very simple exercises. Finger to nose. Make sure that you have to first demonstrate the patient. Today I am going to do some coordination exercise to improve your coordination. Kindly cooperate with me. Okay? So you have to, like what for all other practicals you want to introduce, you want to demonstrate. Okay? So now, see that person is comfortable, keep it down. Okay? So supported well. Okay? Now, ask the person to look forward. Better you can be therapist on front of the patient. Ask him to look at you. You have to sit on the other chair. So you have to sit in front of the patient. Okay? And first you have to demonstrate. You have to demonstrate. See, you have to keep your hand abducted. Abducted 90 degrees. Shoulder abduction 90 degrees. Look straight. Look straight onto my eyes. Okay? Then try make finger, point index finger, and try to touch with the tip of the index finger to the tip of the nose without seeing your hand. Do it slowly with natural speed. Don't do it fast or don't do it slowly. Okay? He has to maintain this shoulder abduction and he has to do like this. He should not see this. He should strike. If you are sitting in front, ask him to look at your eyes. Ask him to look at your eyes. Look at my eyes. Now do that. This tip should touch the tip. Okay? With a natural speed. It should not be too fast or too slow. Okay? Next one is what? Finger to therapist finger. Now you are going to sit in front. Okay? You are going to ask. Okay? The patient's finger. You have to stand just one arm distance. This is one arm distance. Okay? This is what? One arm distance. If you are the patient, I will take your one arm distance. Okay? So one arm distance you have to stand. Now, now you have to touch this. Now, tip. Okay, so this is therapist to same abduction and he has to touch the tip of the therapist finger. Next, finger to finger. Now next finger to finger, same in sitting position, same position. Okay, shoulder abduction of your both hands. Okay, shoulder abduction of your both hands and try to touch tip of this with the tip of this. You should look forward. Touch and go back. Slowly. Slowly means natural speed. With natural speed, you have to do this. Okay? If there is any problem, they will do like this or it will go like this. This might be the problem with coordination. If coordination problem, if you ask him to touch, he will touch it. Okay? These are the problems. Next, alternate nose to finger. Next one is what? Alternate nose to finger. Now, first touch here, then touch here. Okay? Understood? Nose to finger, therapist finger. Next, finger opposition. Very simple. Finger opposition. Ask him to do like this. Okay? Finger opposition. Finger opposition. Next, mass grasp. Mass grasp means taking some water bottle or taking an phone. Grasp. Mass grasp. Grasp. Holding. Mass. Next, pronation and supination. For this, keep the elbow, okay, on the thigh and ask him to do supination and pronation. Do this rapidly. If there is any problem, they can't do this. Coordination, they can't do this. Or they will do that. Okay? Next, tapping hand. Keep it here. Just tap the hand. Next, tap the foot. Very simple. Okay? Next. Now from here, you have to go for lying. Alternate. Heel to knee and heel to knee, heel to toe. Now, you have to ask the person, position, patient has to see this, or you can place this. Okay, make sure that patient is seeing. Okay, understood? So what is that? Alternate heel to knee or to toe. So this is the toe, this is the knee. Okay, what he has to do here is, with the other leg heel, he has to touch the heel, knee and touch the toe. touch here, knee, and touch this. Toe. No, slowly. So, you will smoke? For people who are having smoking, alcohol, or they having some medications, and old people, they will do like that. They can't do it. They will touch somewhere here or here, like that. Okay? Do with that there. With that leg. Nice. With this heel, touch here. Knee. He is touching here, not knee. Next, toe to examiner finger. Maybe he might be aged more. Toe to examiner finger. Now this is the toe. Examiner has to stand. Okay? Now you please try to touch with your toe. This to my finger. Okay? Now, good. Good. Okay? So if there is any problem, they will try to hold like that. Okay? Next is what? Heel to shin. Heel to shin. Okay? So this is the shin. This is the shin. Shin bone. You will call it as shin bone. Now what he has to do here is smoothly he has to do boom. Try to touch it. Slowly, smoothly. Okay? The same thing. If there is any problem, they will try to do like this. They will try to hardly do like this if there is any problem. Or they will try to do like this. They won't do smoothly. As I already told, coordinated movement is a movement which you will do it smoothly, purposeful, with some direction. Having timing, speed, everything is very important. If there is any problem in direction, timing, speed, then it's not a coordinated movement. Okay? Next, drawing a circle. Now, with the leg, ask him to draw a circle. If there is no coordination, he will go like this. He can't do a circle. Okay? Next, fixation or position holding. Fixation or position holding. Holding with closed eyes, hold. If there is any problem with coordination, it will go like that. You can't hold it for long. Understand what I am telling? Holding or positioning. If I am positioning, if I am having coordination, I can hold like this. If there is any coordination problem, my hands will go slowly opposite. I can't hold the position or fixing the position. Okay? So that is about this. This is for checking and for giving treatment. These exercises you will do for assessment and also for treatment. Okay? Next, equilibrium coordination exercise. Equilibrium means in which position you have to do exercise? Equilibrium, standing. Okay? Non-equilibrium, you will do it in chair, sitting with support and in lying. Equilibrium coordination exercise, you will do it in standing. First one is what? Standing in normal comfortable posture. Standing in normal comfortable posture. Next, standing feet together. Standing feet together. Next, standing with one foot directly in front of the other foot. Good. Next, down. Standing on one foot. Standing on one foot. Very simple exercise. Okay? Next, arm position altered in each posture. So now, arm position. Derived. You know derived positions? This is what? This is what position? What standing is this? Reach standing. What is this? Yard standing. What is this? Stretch standing. So that is what arm position altered in each position. Next, displace balance unexpectedly. Displace balance unexpectedly. Now he is like this. You know treadmill? Treadmill, down, walking. You know? If you on the button, suddenly it will move. You will hold. Otherwise, if someone he is holding. Okay? So suddenly moving, try to maintaining the balance. It's nothing but displace balance unexpectedly without knowing the without knowledge of patient. You have to displace the balance. Okay? Next, standing alternate between forward transflexion, return to neutral position. So standing alternate forward flexion and again returning to the stand. Next, standing with eye open and closed ability to maintain position. So first standing with open eyes and then closed eyes. But if there is any coordination problem, there might be some small swaying. Understood? That will be called as Ramberg's test. Okay, now. Standing with eye open and closed ability. Next, standing. This is called tandem position. One foot in front of the other foot, we will call it as tandem position. Tandem position. First with open eyes, next with closed eyes. Good. Now can you see some shaking? Open. Look forward. Open. Close. Can you see some shaking? Next. Walking, placing the heel of one foot directly in front of the toe of opposite foot. Tandem walking. Tandem walking. Walking. One foot exactly in front of the other. Next, walking in a straight line. This is the straight line. Walking in a straight line. That's all. Simple. Okay? Next, walking sideways, walking backwards. And next one is what? Cross stepping. This is cross stepping. Cross stepping. Simple. This is side stepping. Side walking or side stepping. This is backward. And this is cross stepping. Cross stepping. You can ask the person to do it with open eyes. Next with closed eyes. Closed eyes. Okay, if there is any coordination problem, there will be some unsteadiness in the patient. Means they may feel some uncomfortable discomfort, or you may feel some unsteadiness, loss of balance. Okay, especially in cross. Cross, there will be some problem with closed eyes. Okay. Next, march in a place. March in a place. If there is any coordination problem, they will go like this. They will go because there is no coordination. They may move. They can't do this. Or they like that they will do. Okay. Next, step forward around the obstacle. This is called obstacle. Now going there, crossing it. If there is any paper, again crossing it. Obstacles. Keep some obstacles and cross. If there is any coordination problem, they don't know what to do, how to cross. They may feel some unsteadiness, how to do this. They may go like this. They can't cross. Okay? The problem in obstacles. Next, stair climbing. Steps. You know steps? Step climbing with handrail and without hand. So, here is heel touch. Next to here. 2. Right. Okay? Or
Okay, so far whatever you have seen were the testing. Now this is called Frankel's exercise. So he is teaching the person how to do hip flexion along with knee flexion. Okay, so instead of putting a marker, he is using a water bottle. Okay.
you can give some markings. You should not spoil this. You can have one chart. Okay? Prepare one chart and keep it here. Keep 1, 2, 3, or you can keep some lines. Okay? Now touch 1, 2, here, line. 3, 4, 5. So this is for hip flexion. Now if I want to do for abduction, hip abduction, then I will do it here. 1, 2, 3, 4. See? 1, 2, 3, 4. Here. Okay? Do it slowly. 1, 2, 3, 4. Now once if he is having good control, then what I will do, I will ask him 1, 3, 1, 2, 4, like that randomly. Okay, first sequence, next you can go for random. But you want to have, for this problem, you want to give some markings. Whatever the movement you want to do, you need to have some markings. Okay, next. The exercise is repeated. The same exercise you have to repeat for so many times. And last one, all the exercises are very tiring at first. Say first they want to use their brain more. So it will be more tired, fatigue, tired for the patient. So give some rest periods and try to do it. So altogether how many techniques? 7 techniques down. Okay, now can you see there now? Half lying. What is the position? Half lying. This is half lying. Okay? Half lying. Now give markings for hip flexion. Can you see their marking? Can you see their marking on the bed? 1. Okay? See markings, arrow mark. This is for hip flexion. Next, down. So you want to show me in your lab. Hey, 2. Little up. So that is for abduction and adduction. For abduction and adduction, you can do it on the bed, or you can do the placement like this. 1, touch. Next. Next for adduction. Or you can do it on the bed markings. So this is for flexion, extension, marking, and you can give your fingers for abduction and adduction. Next, the same thing which we have done already. Sure, can you know that? We have done now shin, patella, okay? Ankle, shin, patella. Next. The same thing. Sliding on the crest. Shin. Do it. Okay? Next. What is this? Yeah, come on. So now here. Little up. So here hip and knee flexion and extension, both limbs. Yeah. Do it. Again. Okay? Both limbs. Next, one leg extended. Do it the same time. Now this that's all. So first one, both same flexion extension, both limbs. Next, one is going for extension, the other is going for flexion. Reciprocal. Stay. For the patients, this is very important. For people with coordination, they can't do this. You want to give this exercise. It's very important. Next. Next is sitting. Come for sitting. Sit. Knee flexion and extension. Okay? With some progression in the markings. Next. Can you sit here? Okay? Here. Okay? You can give again markings. 1, 2, 3. So 1, 2, 3, 4. Then again. This is in sitting, abduction and adduction for both limbs. 1, 2, 3. You have to give markings. Okay? Next. The same thing. With marking. How to give marking? Can you see there? 1, 2. So you have to make it as. Can you give me pen?
Yes.
Paper? It's easy. Okay? You have to make a big chart, big one. Okay? And put, because your foot, take the foot size. Okay, first, this is for me left, this is right. Now here, I'll make this thing. Okay? So here, 1, this side. Okay, so 1, 1, 2, 2, 3, 3. So if I ask right side, 3, I have to keep it on the 3. If I ask left side, 2, left side, 2, left side, 2. So first what you have to do here is, first go for sequence, 1, 2, 3. Then you can go for right side 2, left side 1. Okay, random. Okay? Yeah, next. Sit to stand, specified count. Okay, 1, 2, 3, like that. Next. So this is very important. Okay? Yeah. This again you have to make the chart. Okay? How to do this here is left to right. Okay? So here left, right. Okay? Then right angle to here. Here what will come? Left. Then again here, right. Then again here, left, right. Then again here, left, right. So you have to mark like this. Then left, right, marking. Then again one more marking. Left, right. Then again left, right. Yeah, if you want to go this side also you can go. You will have left, right, left, right. Same thing. If you go this side or this side, it is the same. If you are going this side, first you will keep right, then left. That is what here. Okay. Next, what is that one in here is, you will make the right. Make it common. You will turn right, keep left. Then again turn right, keep left. Then turn right, left. Turn right, left. So right will be there only. You are going to lift the left. Otherwise, you keep the left common, turn the left, keep the right. Okay? So there is a difference between this and that. So this is side turning and that is pivot turning. This is side turning, side turning. And this is pivot turning. Pivot turning. Next, standing with some weight shifting. Weight shifting to right and left. Weight shifting. Weight shifting to right and left. Next, same, walking sideways with some count. Next, this is the base of support, no? you are going to walk on that footsteps with wide base of support. Next. Yeah. Next. Class. So these are all the exercises you can do.
Okay, so this is about the coordination exercises and the testing. Show you one more video after a small break regarding the exercise. Okay, 2-3 upper limb and lower limb videos are there. We will see that so that you will get a good idea about the Frankel's exercise. Okay, so time is 4 o'clock now. You can take 10 minutes of break. So don't log out. Just you can mute, get up, walk around and come back. So we will meet by 4:10.
Okay, ma'am.
Here you can see a patient is doing the movement.
धीरे धीरे दिखाती हूँ। हाथ खोला, यहाँ लगाया, ठीक है। उसके बाद नेक्स्ट यहाँ लगाया, यहाँ लगाया, यहाँ लगाया, फिर यहाँ लगाया, यहाँ लगाया, यहाँ लगाया। 1 2 3 1 2 3 1 2 3। उसके बाद नेक्स्ट स्टेप 1 2 1 2 1 2 1 2 1 2 1 2 1 2। उसके बाद
Can you see the old man doing? If you see that, he is not able to do it very precisely. Okay. You can watch the video.
थम टू थम, नमस्ते, फिंगर्स खोल के फिर ऐसे जोड़ दिया, नमस्ते, बंद किया। फिंगर टू फिंगर जो जोड़ी है वो नहीं खोलना, कंसिस्टेंट।
So this is a real patient of cerebellar ataxia. So the cerebellum has some problem, so they are not able to coordinate the movement. So you can watch the old man again.
ये जुड़ा रहेगा, ये हो गया। फिर ऐसे ही खोला, फैन योर फिंगर्स क्लोज, पूरे हाथ को जोड़ के फैन योर फिंगर्स एंड देन क्लोज। उसके बाद एक हाथ सीधा, एक उल्टा, सीधा उल्टा, सीधा एक उल्टा। नहीं, एक उल्टा एक सीधा, ठीक है। उसके बाद ऐसे चलना है फिंगर के साथ, आगे पीछे, आगे पीछे, फिर मिडिल फिंगर के साथ 3 फिंगर्स। उसके बाद लिटिल फिंगर भी आएगा, 1 2 3 4 1 2 3 4 1 2 3 4 1 2 3 4 1 2 3 4। फर्स्ट फिंगर, सेकंड फिंगर, थर्ड फिंगर, फोर्थ फिंगर, फर्स्ट फिंगर, सेकंड फिंगर, थर्ड फिंगर, फोर्थ फिंगर। उसके बाद एक आगे एक पीछे, एक आगे एक पीछे, एक आगे एक पीछे, ड्रैग योर हैंड। उसके बाद 1 2 1 2 1 2 1 2 1 2 1 2, बस 1 2 1 2 1 1 2 1 2 1 1 2 1 2 1। हाँ, गुड। उसके बाद नोज, लेफ्ट हैंड से नोज पकड़ा, दूसरा हाथ क्रॉस कर दिए ईयर, राइट हैंड से नोज क्रॉस, लेफ्ट हैंड से नोज क्रॉस, राइट हैंड से नोज क्रॉस, लेफ्ट राइट लेफ्ट राइट लेफ्ट राइट। और फिर पैरों का पॉइंट्स कर रहा है, पेपर के डिफरेंट जगह पे रख दिया पेपर। जहाँ जहाँ पेपर रखे वहाँ टच करना है, एक ही जगह पे खड़े हो जाना है या चेयर लेके बैठ जाना है। फिर आप क्या करोगे 1 2 3 4 5 6 7 बिग टो पेपर के ऊपर आना चाहिए 1 2 3 4 5 6 7 चेंज 1 2 3 4 5 6 7 1 2 3 4 5 6 7 ठीक है। फिर ऐसे यहाँ खड़े होके पैर इकट्ठे जोड़ के खड़े हो गए एक पॉइंट पे, टाइल का ये ले लिया स्क्वायर, ये टाइल का स्क्वायर ले लिया, यहाँ खड़े हो गए, हील यहीं पे है, इसके साथ दूसरा पैर, हील वहीं की वहीं, अभी राइट फुट को रोटेट किया, हील नहीं हिली, हील वहीं की वहीं, उसके साथ दूसरा, फिर हील वहीं की वहीं, तीसरा, अगेन कम बैक टू ओरिजिनल पोजीशन। ओके, फिर दूसरा पैर रोटेट, इसके साथ खड़े हो, रोटेट, इसके साथ खड़े हो, लाइन के ऊपर 90 डिग्री एंगल, कम बैक, इजी। उसके बाद हैंड ऐसे रख के खोला, इसके अंदर 1 2 3 4 1 2 3 4 1 2 3 4 1 2 3 4 1 2 3 4 1 2 डन। टाइमिंग इतनी काफी है।
இந்த ஃப்ரண்ட் 4க்கு 3
Okay, so this is the patient one. Let me show you one small baby's video.
4க்கு 8 வரும். மேல வந்து 4க்கு 8 சரி கரெக்ட் தானே? ஹலோ இல்ல கிரானைட்டுக்கு பாலிஷ் போடுறதுன்னு பாருங்க, அப்படியேதான் இருக்கும். லைட்டா இது பண்ணுவாங்க, மேல இருக்கணும், பாலிஷ்னா போட மாட்டாங்க. எல்லாமே அவ்வளவுதான். எட்டுக்கு 3
Okay, so this is like these are the patient's video. Let me show you once the person is improved little bit, how they are bringing the particular person to us, how they are giving training and improving their sports skill. Okay.
which is coordination. Today we're going to do the one-leg squat reach. I have my assistant Brady. What are you, a sophomore? All right, so what you want to do on this exercise, I'm going to put all my weight on my left foot, raise my right leg 1 to 2 inches off the ground, and I'm going to also keep this foot next to the other foot throughout the whole exercise. I'm never just swinging it back or forward. So I'm going to raise my right arm up. Next, I'm going to reach down, go for the left side of my left foot, right back up, left side of my left foot, right back up. You will repeat that about 5 times with each leg. So I'm going to show Brady how to do the same thing. So put all your pressure on your left leg. Let's go lefties first. Brady, okay, good. Did you see his right foot is raised off 1 to 2 inches off the ground? Raise your right arm up to the sky. All right, and now you're going to touch the left side of your left foot. Go down. Good. Right back up. Go down again. Good. Right back up. Let's go 3 more times. As you can see, he's not letting his right foot swing all the way back, which is also working on balance. And you see a little bit of shake. This is working on your stabilizers. That's why it's a balance exercise. It's going to increase your balance. One more. Good job, Brady. And that works for balance. This exercise is called the lift off. All right. So first thing you want to do in the lift off is put your feet together, and then next thing is going to be lean over. You want your back parallel to the ground, and now your arms are just hanging. Now simultaneously, you're going to raise both arms out to the side while your right leg is going straight back, like this. Right there. Go back down. Do not let your feet touch. Just everything's hanging. Back up. Back down. And you want to repeat this 5 times. And I'm going to have Brady do it now so I can show you. Stand sideways, Brady, facing there. All right. So his feet are together. Second thing, he's going to bend over. Okay, back is parallel, as you can see, to the ground. Now simultaneously, he's going to raise both arms out to the side. Let's go with your right leg straight back. Go. Good. Did you see his foot did not touch at the bottom? Perfect. That's 2. Give me 3 more, Brady. That's 3. 4. Good. You see that leg is shaking. It's fighting for balance. 5. Good job, Brady. And that's an exercise that incorporates balance. And this exercise is a 1-foot hop, forward and backward. First thing you want to do is put your right foot on the line, left foot forward, and right arm forward. And the next thing you do, you're going to jump forward, boom, and you're going to switch arms, just like that. As you can see, my left arm is forward now, and my left leg is back. Then I'll jump back, switch, and then this is what it'll look like. You see, I'm chopping my arms, working on my balance and my coordination, and I can switch left foot forward, right leg forward, just like that, left foot on the line, left arm forward, and then you're gonna go, boom, switch, boom, and it looks like this. And that's both legs working on my balance and coordination. And now I'll be explaining, showing Brady. All right, put your right foot on the line, all right, left leg forward, right arm forward. All right, let's jump and stop, boom, okay, as you can see, good. And he's chopping. All right, start over, Brady. No worries. As you can see, this is a complicated, but once you get it, it's a natural fluid motion, okay? So when you jump, I want you to stop and hold, okay? So jump, boom, okay. And now as you see, his left arm is forward now, left, and jump back and stop, boom. And jump again and stop. All right, now keep going. And if you don't start with the kick on the beginning, you'll be already off. Good, there it is. Exactly. And you see how he corrected just by chopping his arms. Good, and let's try with the other foot, okay? Left foot on the line, right leg up, left arm up, okay? Go and stop, good. This is a balance and coordination workout. Go back again, stop, okay? And now go. You see, yeah, once he gets the kick, there it is, once he has a kick. All right, start over, we're gonna start him back over, okay? Left foot up there, right foot forward, left arm up, okay? Go forward, skip, good, go back. Go forward. Now overemphasize on the kick, Brady. Boom. There you go. So when you overemphasize, that will keep your coordination. You had it for 1 second. All right, go do it one more time. Let's start back left foot forward, left foot on the line. Okay, right leg up, left arm up. All right, go. Back. There it is. Good, good. There it is. Good job. As you can see, this is a 1-foot hop forward and back, and this will definitely work on your coordination and your balance. And this will also entail in any sport that you do. It doesn't matter if you're playing tennis, football, basketball, hockey, any sport. This will emphasize on your balance and your coordination. And this exercise will be helping you with your balance and coordination. It's a 1-foot hop, lateral hop, side to side. So what you're gonna do first, put all of your weight on your right leg, and I'm trying to stay on the balls of my feet. Next, I want my hands to my side, and then I'm gonna flex my stomach because you want a tight core, because core is involved in everything you do. So I'll jump to my side, and I'm trying to gather myself. I don't want to go back yet. I want to work on it. Feel that balance, really feel it. Boom, hold, as you see, try to gather yourself. Go again, just to get acclimated. Now you do the exercise. So I'm keeping my core tight. That's my center. This is my center. Now I'm gonna go to the other leg, same thing. All my pressure on my left leg, on the balls of my feet, hands to my side, core tight. Jump, get acclimated, jump. As you can see, it's a balance exercise, coordination. Jump, and now you go. Stand on the balls of my feet, my core is tight. As you can see, my center is staying above this black line in the middle. All right, now we're gonna have Brady. All right, put your right foot over there. All right, all this weight is on his right leg. Okay, hands by your side, core tight and flex. All right, jump over there and hold. All right, jump back and hold. Jump over there and hold. Okay, so his body's getting acclimated. Now you're gonna go back and forth. Nice tight core. Good, that way that's his center. No matter where his foot goes, the center is aligned in the middle. It stays right there. Good, let's do the other leg. Okay, all his weight is gonna go on his left foot now. Hands by his sides, core is tight. Jump in and stay. Jump over there, stay. Jump over here. And as you can see, I make him stay until he finds his balance, finds your center. That's so important to find your center. All right, now go back and forth. Good job on keeping your core tight, Brady. All right, that's good. What I'm going to show you is a 1 foot square jump. All right, so Brady, give me a little bit of space. So I'm going to start with my right foot first thing, and then I'm going to put all my pressure on my right, hands by my side, and my core flex tight. So what we're going to do first, we're going to hold each spot, which is going to be very tough to work on your balance. Jump forward, boom. Jump to the side. As you can see, I hit it. Jump back. And then jump over again. So we're going to do this one more time. Count to 3. 1, 2, 3. To the side. 1, 2, 3. Right there. 1, 2, 3. And over. 1, 2, 3. And after you learn how to hold, now we're going to do this repeatedly without stopping. So it'll look like this. And this is for coordination and balance. And also, another thing you can do in this workout, rather than going around clockwise, you can do the same thing the opposite way. Hold your 3 seconds. And then you go without stopping like this. And you're gonna work different areas of your muscle by going opposite ways. So if you have to push off right or left, particular to whatever sport you were playing, this will be worked on. Now I'm gonna have Brady do it. Okay, Brady, so we're going to put all your pressure on your right foot. Good. Get a little more space more over because you want to not be so close to the cone. Good. I'll raise the left leg up. Hands by your side. Tight core. Jump forward. 3 seconds. 1, 2, 3. To the side. 1, 2, 3. And back. 1, 2, 3. And over. 1, 2, 3. One more time to get those legs acclimated to this. 1, 2, 3. To the side. 1, 2, 3, back. 1, 2, 3, and over. You can put your foot down now. What he's trying to do is stay on the balls of your feet. So now I want you to do this workout without stopping this time, going in the square. Good, now stop. Okay, now I want you to try to do it the opposite way. You're gonna start back here, start all the way back here. You're gonna go 1, 2, 3 on each spot. 1, 2, 3. As you see his body shifts, you got to keep the core tight and stabilizing those muscles. But to the left, and then back. All right, now let's go without stopping. And that's his right foot. Now we're going to do his left. All right, so same thing repeats with the left. All right, bounce on your left foot. You're going to be on balls of his feet, hands by his side, core tight. Jump forward. 3 seconds. 1, 2, 3. To the right. 1, 2, 3. Back. 1, 2, 3. Over. We're trying to stick the landing. We're not trying to shift, but it's a very hard workout when it comes to balance and coordination. So one more time, let's go around, try to stick it if you can. 1, 2, 3, good job. 1, 2, 3, back. As you see, his body's finding his center now. Grabbing 1, 2, 3, and over. All right, both feet down. All right, now I want you to go all the way around without stopping. Good. All right, now stop. Okay, and we're going to go the opposite way. And as you remember, we're trying to hit 4 points. I know Brady's getting acclimated to this coordination. We're going to start right here. The goal is 1 spot, 2 spots, 3 spots, and back to the starting point. All right, so give it a shot. You can go non-stop. Okay. All right, boom, 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 boom. Yes, good job. There it is. All right, thanks a lot. And this will work on your coordination for any sport that you play. I don't care if you are a tennis player, basketball player, football player, track and field athlete. It will help with your balance and coordination for all of these workouts. And thank you all for watching.
Okay. So when you are seeing the real patient, it will be little different. That's why I wanted to show you the real patient video. Okay, but when you are when we are doing it with the model, it will be more easy because the model will not have any problem with in coordination. So when they are doing the movement, it will be very easy. But the real patient movie, when you're treating a real patient, it will be a little difficult. Okay, so now we'll just see how to do it like how to do it in our OSPI. So in the OSPI exam, it will be like this. Okay, so the questions will be like this. A 30-year-old or a 90-year-old person is coming to the department with difficulty in climbing the stairs. On examination, you found that the person is having incoordination in his lower limb. Okay, train any 2 voluntary movement for his hips or knee joint. Okay, the question will be like this. A small case scenario over this question and this one, then the question will be like this. Train any 2 movement for the lower limb, train any 2 movement for the upper limb, train any 2 movement for the lower limb in sitting, or any 2 upper limb coordination test or any 2 lower limb coordination test. So when you read the question, take some 30 seconds to understand the scenario, understand the case scenario. Then you form a line, or you can just form your answers mentally. Then you start doing the movement. So first thing is you need to introduce yourself to the examiner and to the model. Then you explain what is the problem to the patient. So you can say, from the case sheet, I come to know that you have difficulty in climbing up the stairs, and on assessing, they have found out that you have problem with the coordination. So I'm going to teach you some exercises now that will help you to improve the coordination, and that will help you to improve the stair climbing. So here you need to explain the patient, what is the patient problem, what you are going to do, and how it is going to help them. So 3 things you have to explain. Is that clear? So after explaining all these things, you ask the person, do you have any doubt or do you have any questions? So when they say no, then you ask them about the concern. So while performing the exercises, I'll be touching some of your body part. Is that okay for you? Can I get your concern? So once they give the concern, you then start the exercises. So first you have to position the stimulator. So position the stimulator accordingly in such a way that they are able to watch the movement. So in case if you are doing the movement in lying down position, then make them position in a half lying position. If you are doing the movement in the sitting position, you make sure that they are able to observe the movement. Okay, so that will be the position of the stimulator. Then explain them very concisely, demonstrate the exercise before you are going to do it. So clearly demonstrate like this only you are going to do the movement, like this only you are going to move the limb, like that you have to clearly explain them. So after explaining, then you are supposed to do perform the movement. Is that clear? So first clearly explain, then clearly demonstrate. After that only you are supposed to start the movement. So for example, you are going to do the movement in lying down position. So make the person to be in a half lying position. So in case if you are there at home, you can use 3 or 4 pillows and make them to lie in a half lying position. Then with the help of a pen, or you can keep different color papers or something, you can keep it from extension till flexion. Okay, then after keeping the different color pens, then you can ask them, now you bring the leg to pink color, bring the leg to red color, bring the leg to yellow color. Like that you have to orally dictate. So when you are dictating, first they will be doing it very slowly with dragging on the bed. So for example, you have kept 3 different colors, one in some 10 degrees, pink color, yellow color and orange color. Then you can say bring it to pink color, then they will drag the leg and bring it to pink color. Then drag the leg and bring it to yellow color. Like that they will be dragging the leg and bringing the leg to that different colors. So when they are bringing like this, you are supposed to watch that whether they are doing it precisely over that particular color. If they are not doing precisely, then you have to make them to do many repetitions so that they are able to do it very precisely. So this is first one. Then progression will be, you can do this itself in a little speed mode. Okay, so the progression can be by increasing the speed, by increasing the complexity, and by moving in the air. So increasing the complexity means instead of making them to bring in a particular sequence, you can jump the sequence. So when the colors are like pink, yellow and orange, then you can ask them to bring to pink, orange, yellow, pink, like that alternatively you can make them to do. So that is increasing your complexity. Okay, then another way of progressing is you can first make them to do in dragging, then ask them to lift the leg and bring it on the pink, lift the leg and bring it on the yellow, like that. Then next progression is you can ask them to do it in the air. So up in the air they can just bring it to pink, yellow, like that they can do it up in the air. Okay, so like this only you are going to increase the complexity. Okay, then you can tell the examiner that we will be repeating the exercises many times until it is done perfectly. And first you start with an easy one, then you can go to a complex one. So the exercise you can, I have given some in the slides. So that will be like for an example only. But if you want, you can see to that, and you can do many different types of exercise also. You can make it. So it is up to your own this one exactly. So you can see here. So here they have drawn the lines. So can you see the lines? So this lines you can draw in different colors. Then ask the person to drag to that particular color. Okay, then lift and bring it to that particular color. Then move it in the air. Okay, so like this. Then this is in lying down. So this is half lying position. This is your sitting exercise. So from sitting, this is the feet. So you can ask them to bring the heel to number 1, bring the toe to number 1. Like that you can give different directions and positions. Okay, so this you can do it in sitting. Okay, same thing you can also do it for upper limb. You can hold different color pens and ask them to touch the pen. You can keep different object and ask them to touch the object. So anything you can do for upper limb also. Is that clear? So do you have any doubt? I have got the LMS link from Ms. Susmita. Okay, I will upload now after the class.
So far, no questions.
Okay. So if no questions, then we can close the class. Okay, so thank you all. I will upload by today itself. Okay.
Thank you, miss.
Thank you.